hide and seek, hide and seek, hide and seek. Have you ever played this famous game when you were a kid? Would you like to play with me again today? So be with me. Today's topic is interesting, same like that hide and seek. So today we are going to be a seeker and interdental caries will be our hider. We will explore all the hidden secret of interdental caries. What is it? What are the causes of interdental caries? How to diagnose and treatment of interdental caries. And at last, we will also explore how to prevent interdental caries. So now coming to what is interdental caries. As the name itself suggests, it's in between teeth. So what happens when it is in front tooth? Then we may get knowledge about that there is caries and we might get treatment on time. But what happens if it's there in the back tooth, in between molars and premolars? It hardly get noticed until and unless we find any discomfort or pain or sensitivity to the hot, cold, chewing, anything, anywhere, any kind of discomfort. That's how that causes hidden danger. So we must acknowledge it. So now what causes interdental caries? I will divide this into 5 subtypes: poor oral hygiene, lack of fluoride, sugar and acidic foods, dry mouth, and malaligned teeth. What will happen? All these causes will, this poor oral hygiene and malaligned teeth especially, it will result in improper clenching of the tooth and there will be food lodgement here and there in the mouth. This food lodgement will form a slime layer on the tooth surface and this slime layer will harbor bacteria. Once we eat sugary food, what this bacteria will do? Bacteria will digest sugary food and will release acids continuously. If again there is a release of acids and we are eating acidic food also, then it will decrease pH of our saliva, and if there is decreased pH of the saliva, then they will start eroding enamel layer of the tooth and then dental caries. Now coming to another cause of interdental caries, that is dry mouth. What will happen if there is dry mouth? There will be less saliva or negligible saliva. Negligible saliva or less saliva, it won't be able to neutralize the pH balance of the mouth. If there is no pH balance, so there will be uncontrolled acidic environment of the mouth, and this acidic environment will erode tooth enamel and will cause dental caries. Next one is lack of fluoride. What is the function of fluoride? Fluoride helps in remineralization of tooth enamel if it's decayed. If there will be lack of fluoride either in the form of diet or fluoridated toothpaste, there will be lack of remineralization of demineralized tooth enamel. So if there is continuous tooth decay, tooth erosion, but remineralization won't happen, then there will be continuous viscous cycle of dental caries and all. Now coming to the diagnosis of interdental caries, I will discuss this into 2 parts: how patient will feel and how we dentist can diagnose. What patient will feel is there will be continuous food in between teeth, pain on pressure, occlusal while chewing food, or there is sensitivity to the hot, cold, anything. If any symptoms you are feeling, you can just visit your dentist nearby and ask for proper treatment. How we dentist diagnose is either clinically, actually it's very hard for us also to find because it's invisible. So most commonly we use this X-ray method. X-ray we can do either with the help of intraoral periapical radiograph or bite-wing. Most preferably is bite-wing radiograph. Now coming to treatment of interdental caries, I will divide this into 3 phases. First phase, if only enamel is affected, in that case what we do is we just remove decayed part of the tooth and restore with GIC or composite. In second phase, enamel and part of dentin is affected. In that case, patient won't have pain, but patient might feel little sensitivity to the hot and cold. In that case, we will seal dentinal tubules and restore with GIC and composites normally. But in third phase, enamel, dentin and pulp, all of three is infected. In that case, we need to go for RCT, root canal treatment, and after root canal treatment, crown. Now, coming to preventive measure. We all should know what is the preventive measure to stop this interdental caries, because it's very scary, hidden secrets. So, first, maintain good oral hygiene. Do brush twice daily. Do interdental cleaning properly, either with the whatever suits on your teeth. It might be either dental floss or interdental brush or unit-tufted toothbrush, anything. Then you must use fluoridated toothpaste to, if there is any chance of caries decay, enamel demineralization, then we can correct that. Third is drink lots of water. Keep your mouth hydrated. Keep water in like little like in sipping form. Fourth one is regular dental visits. We must visit dentist after every 6 months. So how I can conclude? So maintain oral hygiene, maintain oral hygiene. Keep your tongue, teeth, mouth, gingiva, everything clean. And one more pro tip I would like to give. In case if you are not willing to use interdental cleaning aids, or we are not comfortable, what you can do is you can replace with lukewarm salt water gargle. You have to take half glass lukewarm water, in that half teaspoon of salt, mix it until it's completely mixed up, and you can just swish around your mouth for 30 seconds minimum, so that it should go in all your interdental area and it will kill whatever microbes is there and you will feel fresh. Don't eat anything after doing lukewarm salt water gargle for 30 minutes. That will be beneficial for you. Thank you. Do follow dentistmumma.com for amazing dental tips. You can follow dentistmumma on the Facebook, Instagram, Quora, Pinterest, LinkedIn, whatever you are using, wherever you feel you are comfortable. So let's connect together. Let's share your problems. I will deal with that. Thank you. Don't forget to like, subscribe, and comment.